Yeah, hi everyone. Welcome to my YouTube channel again. This is Dr. One. Today we're gonna treat the topic called infertility, and to be more precise, infertility in women. Infertility is when a couple cannot get pregnant, conceive despite having regular unprotected sex for 1 year, say 9 months to 1 year. Around 1 in 7 couples may have difficulty conceiving. More than 8 out of 10 couples where the woman is under 40 will conceive naturally within a year if they have regular unprotected sex every 2 or 3 days. For couples who have been trying to conceive for more than 3 years without success, the likelihood of getting pregnant naturally within the next year is 1 in 4 or less. Now, getting help. Some people get pregnant quickly, but for others, it can take longer. It's a good idea to see a GP if you have not conceived after a year of trying. Women age 36 and over, and anyone who is already aware they may have fertility problems should see their GP sooner. They can check for common causes, which will come to that one, and suggest treatment that could help. Infertility is usually only diagnosed when a couple have not managed to conceive after a year of trying. Now, there are 2 types of infertility. We have the primary and the secondary. Primary infertility, that is where someone who's never conceived a child in the past has difficulty conceiving, whereas secondary infertility is where someone has had 1 or more pregnancy in the past but is having difficulty conceiving again, which will come to that one. So let's go for treatment. Treating infertility. Fertility treatment include medical treatment for lack of regular ovulation, surgical procedures such as treatment for endometriosis, repair of the fallopian tubes, or removal of scarring tissues, which we call them adhesion within the womb or abdominal cavity. Assisted conception such as IUI, that is intrauterine insemination, or IVF. The treatment offered will depend on what is causing the fertility problem and what is available from your local integrated care board, ICB. Private treatment is also available, but it can be expensive and there is no guarantee it will be successful. It is important to choose a private clinic carefully. You can ask a GP for advice and should make sure you choose a clinic that is licensed by Human Fertilization and Embryology Authority, HFEA. Some treatment for infertility, such as IVF, can cause complications, for example, multiple pregnancy. If more than 1 embryo is placed in the womb as part of IVF treatment, there is an increased chance of having twins. This may not seem like a bad thing, but it significantly increases the risk of complication for you and your babies. Ectopic pregnancy. The risk of having an ectopic pregnancy is slightly increased if you have IVF. Now, let's look at the causes. What causes infertility? That's the big question. There are many possible causes of infertility, and fertility problem can affect either partner. So this is not only an issue of a woman, but in a quarter of cases, it is not possible to identify the cause. Common causes of infertility include lack of regular ovulation, the monthly release of an egg, poor quality semen, blocked or damaged fallopian tube, endometriosis, a condition where tissues similar to the lining of the womb, endometrium, grows in other places without places outside the womb. A risk factor. There are also several factors that can affect fertility. These include age. Fertility declines with age. So this is what I wanted to say to explain further. So if you are over 35 years, the chance of you becoming pregnant is quite low. It's less than 75%. So I would say the earlier you get your baby, the better for you. Another thing is weight. Being overweight or obese, having a body mass index of over 30 reduces fertility in women. Being overweight or severely underweight can affect ovulation. Sexually transmitted infections, STIs. Several STIs include chlamydia, can affect fertility. Smoking can affect fertility. Smoking includes passive smoking, affect your chance of conceiving and can reduce semen quality. Now, the other one is alcohol. The safest approach is not to drink alcohol at all to keep risk to your baby to minimum. Drinking too much of alcohol can also affect the quality of sperms. The chief medical officer for the UK recommends adults should drink no more than 14 units of alcohol a week, which should be spread evenly over 3 days or more. Environmental factors. Exposure to certain pesticides, solvents, and metal has been shown to affect fertility, particularly in men. Stress. Stress can affect your relationship with your partner and cause a loss of sex drive. In several cases, stress may also affect ovulation and sperm production. So these are all some of the things that I have been preaching on the platform. So we're going to look at now the causes now. So infertility may be caused by many different things. For 1 in 4 couples, a cause cannot be identified. Infertility in women. Infertility is commonly caused by problems with ovulation, the monthly release of an egg from the ovaries. Some problems stop an egg being released at all, while others prevent an egg being released during some cycles, but not others. Ovulation. Ovulation problem can be as a result of PCOS or PCOS, polycystic ovary syndrome, thyroid problem, both an overactive thyroid gland and an underactive thyroid gland can prevent ovulation. Premature ovarian failure, where the ovaries stop working before the age of 40. Scarring from surgery. Pelvic surgery can damage and scar the fallopian tube, which link the ovary to the womb. Cervical surgery can also sometimes cause scarring or shortening the neck of the womb, the cervix. Cervical mucus problem. When you are ovulating, mucus in your cervix become thinner, so sperms can swim through it more easily. If there is a problem with the mucus, it can make it harder to conceive. This point is very important. So make sure that you do this cervical mucus problem or mucus check. The mucus in the cervix also need to be checked for their thickness. So if it is as it says here, if it is too thick, the sperms cannot get through. So that becomes an obstacle here. And also we do understand that premature ovarian failure, there are people that their tubes are all blocked at a certain age. So over 40, I would say, is kind of risky. Yeah, so that's the bad news here. Now, fibroids. Non-cancerous growth called fibroids in or around the womb can affect fertility. In some cases, they may prevent a fertilized egg attaching itself in the womb, or they may block a fallopian tube. Endometriosis. Endometriosis is a condition where tissues similar to the lining of the womb, endometrium, grows in other places outside of the womb. This can damage the ovary or fallopian tube and cause fertility problems. PID, which stands for pelvic inflammatory disease. PID is an infection of the upper female genital tract, which includes the womb, fallopian tubes, and ovaries. It's often caused by sexually transmitted infection, STI. PID can damage and scar the fallopian tubes, making it virtually impossible for the egg to travel down into the womb. Sterilization. Some women choose to be sterilized if they do not want to have any more children. Sterilization involves blocking the fallopian tube to make it impossible for an egg to travel to the womb. It's rarely reversible. If you do have a sterilization reversed, you will not necessarily be able to have a child. Medicines and drugs. This one also is important. The side effects of some types of medicines and drugs can affect your fertility. These include non-steroidal anti-inflammatory drugs called NSAIDs. The long-term use of or a high dose of NSAIDs such as ibuprofen, aspirin, can make it more difficult to conceive. Chemotherapy. Medicines used for chemotherapy can sometimes cause ovarian failure, which means your ovary will no longer be able to function properly. Neuroleptic medicines, a antipsychotic medicine often used to treat psychosis, can sometimes cause missed period or infertility. Spironolactone, a type of medicine used to treat fluid retention or edema. Fertility should recover around 2 months after you stop taking spironolactone. Illegal drugs such as marijuana and cocaine can affect fertility and make ovulation more difficult. So we will just try to see if we can incorporate those of men also, or I'm gonna make another one for men specifically, because it's a very broad topic here. So I will just stop here and then make another one for men, like so it becomes a complete balanced topic. Thank you and have a wonderful evening. My name is Dr. WAN. Ciao.